Okay, well, hello, everybody. We are so thrilled that you're here to be on the webinar about the ABCs of effective advocacy. CADCA has a new advocacy toolkit that I hope all of you have seen and downloaded. And I'd like to thank Chris Dorn, who's CADCA's senior, he's our public policy manager, who has done such a great job putting the information for the toolkit together and also helping me put the slides for this webinar together. So Chris, if you can move to the next slide, please. Okay, so how does an issue get on the policy radar screen? It obviously requires people to be organized, to be vocal, to be visible, and to be valuable. We need to be willing to be forceful enough to do what it takes to put our issues on the top of elected officials' agendas. And I'm going to get into in a minute what it means to be vocal, visible, and valuable. But I love this quote from Napoleon Bonaparte. 10 people who speak make more noise than 10,000 who are silent. And that is really the case in anything to do with public policy. The squeaky wheel gets the grease. The people who show up, who speak up, and who are sort of there knocking on doors are the people who get the attention of elected officials and policymakers at all levels of government. Next slide, please. So what does it mean to be vocal? Next slide, please. It means you need to speak up. So you have to call and write your legislatures, leave messages, meet their staff, build relationships with them, write op-eds and letters to the editors about issues of importance to your community and your coalition, engage with the media in other ways. And I don't know how many of you did this, but CADCA got out an election guide about, I don't know, 3 or 4 weeks before the election that included a whole bunch of questions for you guys to be able to go to candidate forums and ask the candidates so that we could get on the record what it is that they had said, and so that they knew that this is an issue that their constituents cared about. So asking prevention related questions at candidate events, town hall meetings really is another really good way to speak up. Next slide, please. So what does it mean to be visible? Okay, so it means you need to show up, attend substance use prevention rallies in your state capitals, or please come to DC and participate in our Capitol Hill Day at Forum. It's a great way to quote, show up, even though this year is going to be virtual again. The more people on the same day with the same messages that call people across Capitol Hill, the more attention we get, and it shows that we show up and that we care about our issues. Be interviewed about prevention issues and other issues you care about on local radio, TV, podcasts, etc. Hold coalition events and invite legislatures and their staffs to show up. They love to get a chance to speak to people who elect them in their states and their districts. And you'd be surprised at how excited they are to attend events in the communities. Get your supporters to attend committee hearings, to testify at hearings at all state levels of government. Promote your coalition meetings on social media, run ads in your local paper. Do anything you can to show up and to show that this is an issue that we really care about to elected officials and key policy people. Next slide, please. And what does it mean to be valuable? Okay, it means that you have to show your value in a number of different ways. We are the experts on substance use prevention, treatment, recovery support, harm reduction across the board. We're the experts in our communities, in our states, and at the federal level on these issues. So we need to be a resource to our elected officials. We need to share data with them. We need to educate them about what's really going on. And that's really valuable to them because these people are generalists. The only way they're going to have any idea about what is going on in their communities with the issues that we care about is if we share the information with them, the data with them, we meet with them and tell them what's going on. That is really valuable, being a resource. Invite legislators to coalition meetings or events such as drug take-back days. You'd be surprised how many legislators, especially at the federal level, have people in their districts. Senators have district offices. Every member of Congress has a district office. And the people that work in those offices love to come to these coalition meetings because it's a one-stop shop for them to meet the school people, the police people, the parents, the business leaders, the medical community, parents, youth, and everybody else. So if you don't have your local elected officials, staff people at your coalition meetings, invite them. They love to be involved. You can be valuable by recognizing legislators who've been helpful by giving them awards and public recognition. That's a value to them because it gets their pictures in the paper and it gets them, you know, good notoriety and positive feedback from people in the community. So definitely recognize people with awards, even if they don't 100% deserve them. It gets on their radar screen if you tell them that they're doing a great job on something. And then definitely offer your expertise on substance use issues on an ongoing basis, especially when you don't need something. Like any other relationship, if you wait till you need something to ask somebody for something and they don't know you and they don't know who you are, they're much less likely to do it than if you've built a relationship over time by being a resource, providing them with data and information. Then when you actually have an ask, they know who you are and they're much, much more likely to do what you need done. And always share your outcomes and your successes with your elected officials at all levels and explain how you achieved them. That is really valuable. We have unbelievable data showing that your work at the community level has decreased substance use rates really exponentially, and that's valuable. Tiny little investments of resources in substance use prevention pay very big dividends. And that's something that we really, really need to share because it's very valuable that we can change population rates of substance use among youth. Next slide, please. So I'm going to put advocacy into action now. Okay, so next slide, please. What is it that you can do to participate in advocacy efforts? Well, at the very low lift of this, like what can you do that doesn't take a lot of time or effort? You can post on social media, definitely respond to all of the CADCA legislative alerts that you get. That's a really low lift. It takes about 20 seconds if you're already registered in our system, and your letter goes to your 2 senators and your 1 representative from you as an individual, from your home address. Everybody should be doing this. Very low lift, but it makes a really big difference. And Chris just added up how many legislative alerts we had sent to Capitol Hill last year, and it was over 3,500. And it's one of the reasons that we've had a lot of success with things so far, like stopping the Safe Banking Act from moving. A medium lift, write a letter to the editor or an op-ed on an issue that you are passionate about and that you'd like the community to be aware of. Call your member of Congress and tell them how you feel about something. And again, be a resource, give them data and information, and then write, email, or fax your members of Congress. So what's a higher lift? So attend meetings with your members of Congress and their staff, also your county commissioners, your city council members, mayors, state legislators. Absolutely set up and attend meetings with them. Ask questions at debates between candidates and also at candidate forums where just the candidate themselves is in the community trying to shake hands and get votes. We need to show up at those events and give testimony at all levels of government on issues that are coming before a legislative body. And if you yourself can't do it in your official capacity, do it as yourself as an individual and line up other people in the community to do the same thing. Next slide, please. So now I'm going to take you through something that those of you who know me and have heard me speak before know I love acronyms. And so this one we call the frame. And so what is the frame? It's a 5-part way to be an effective advocacy. So the first letter of the frame, F, equals facts. The second one, the R, is reduced to 1 page. The A stands for anecdotes and stories. The M is how to map out an advocacy strategy. And the E is evaluate your results. So now I'm going to, in a second, take you through one by one the parts of the frame and go through each one of them on how we can best do what we need to do to be effective advocates. So next slide, please. So F equals facts, the data. Not only know the facts, but know how to share the facts in a way that's really going to grab your elected officials. Next slide, please. So what are facts? Data, statistics, research studies, evidence-based strategies, and recommendations. The thing about facts is, for the most part in our field, they're science-based. We don't make up facts. Therefore, you have to cite your sources, including on things like school student surveys. Put in what the survey instrument was, the years that it was, given and who it was given to. So always cite your sources, really, really important, because that gives us credibility. Next slide, please. So where do you find facts? Well, preferred sources would be government sources at the federal level, CDC, ONDCP, SAMHSA, peer-reviewed research and literature. At the state level, state survey data, state data, crime data, any sort of government sourced data is very, very, very good to use, as is your local data, your school survey data, crime incident data around marijuana dispensaries or alcohol outlets. All of that is very important. So the caution is fact sheets from other nonprofits, only use them if they themselves are cited. If they don't have citations, don't use them. But definitely just be cautious picking stuff up from other people's fact sheets, and make sure that you check the sites to make sure that they're accurate. Don't use Wikipedia or any other unsourced websites because they don't pass muster with policymakers and others. So definitely stick to things that you can cite, and Wikipedia is not a site. Don't cite Wikipedia. Okay, next slide, please. So the R, reduced to 1 page. This is extremely important, and it's really important because all elected officials are really busy, as are their staffs. So we can have an amazing 200-page study and document on something, and literally, unless we can reduce it to 1 page, we can give it to them, but they're never going to read it, and they're probably going to throw it in the garbage can. So if you do want to bring in the big study, you need to have the 1-pager on top of it that actually summarizes the findings of whatever study it is. Same with statistics. They all need to be boiled down, hopefully to 1 page that shows either increases in something good like high school graduation rates, or decreases in things that we're working to decrease, like substance use among youth across all substances. Next page, please. So this is a great example. This is the outcomes from the Drug-Free Communities program. ICF International does the evaluation every year. This 1-pager that we use on the Hill every single time we go up there and every single time we have a meeting comes out of a 100-page yearly document that evaluates the whole program. But nobody's going to read that. But this tells them very quickly in 1 page that the program is really effective, that since the inception of the program, all drug-free communities coalitions, and this is basically on my left, have been able to reduce alcohol, marijuana, tobacco, and prescription drugs from 2002 to 2021 by tremendous amounts. We have able to show here very quickly that middle and high school use, because of having a drug-free communities coalition since the beginning of the program, all grantees gone down exponentially. And the right-hand side shows the same thing, but for the latest cohort of drug-free communities coalitions that was included in this report. And again, you can see really pretty major reductions, even in marijuana, which at best is stable, if not going up in some places. But for DFC communities, we're still seeing reductions in both middle and high school use. That's an amazing thing. So again, anything you can do to put stuff in a chart or a graph from a baseline to show decreases in things that we're working to decrease or increases in things we're trying to increase, like perception of social and parental disapproval, all of that stuff needs to be boiled down to one page. Next slide, please. Okay, this is an example from the North Coastal Prevention Coalition in California. They got a STOP Act grant, and what's great about this is they were able to show how youth in their community access alcohol. And why was this important? Because they were trying to get some policy changes made. And this shows that house parties and family and friends were by far the biggest reasons that kids were accessing alcohol in this community. Clubs, restaurants, markets, and stores were really not the problem. So you have to have data to be able to know what the conditions are in your community that you're trying to change. They use this to get a social host ordinance passed. So again, having data in a graph or a chart that shows something in one page, really important. Next slide, please. So there are a couple of questions to consider for your one-pagers when you're reducing your facts, your data, and your studies down. One, is your data accurate? It has to be accurate. You lose a lot of credibility if you give people the wrong information and then they repeat it. They're not happy about that, obviously. Is the data accessible and understandable to people who aren't in our field and don't know the issues? It has to be in a format and you have to look at it and understand what you're looking at. So is this something that people who are not experts in substance use issues are going to be able to understand? And also, is the data actionable? Are they going to be able to actually decide to make a decision based on the data that you have presented to them? So those are three very good questions to ask yourself when you're putting your one-pagers together. Next slide, please. Anecdotes. So anecdotes are stories. Anecdotes put a face on the data to make it relevant and relatable, to pull at someone's heartstrings. So data is necessary. You have to have data, but it really helps you to have an anecdote that puts a face on the data, to tell a story, to bring someone with a personal experience in, to bring kids in that can tell you what the data means to kids in the community. Anecdotes are not sufficient, but they really are necessary to help you make your case so that the data sings to people as opposed and resonates to people as opposed to as just, oh, well, what does it really mean and who cares? Next slide, please. So anecdotes matter. They make data resonate. They put a human face on it. They make it human, and they really make people get it and understand what it is you either need to have done based on data or to prove that you've done something fantastic that they need to know about and that you have some successes based on the data. So anecdotes, as I said before, are necessary but not sufficient. You can't just go in with anecdotes and stories without data. That will not work. But the two together really are what puts it over the top for people. Next slide, please. So the M in the frame stands for map out your advocacy strategy. So next slide, please. So this is what we're going to call advocacy in action, and we call this the power analysis. Next slide, please. So the power analysis basically is figuring out exactly what you want to change, or in some cases, what do you want to stop from changing? like some of us who are working from stopping state laws from changing about marijuana hallucinogens and other things. So what do you want to change, or what do you want to stop from changing? Once you figured that out, you need to figure out, how do you get the change that you want made? Through what system? Do you want a law changed? And then I'll get to this in a minute. Then you'd have to go to a legislature, a regulation changed. Then you'd have to go to the executive branch agency that is in charge of regulations. Do you want a policy of some sort changed? And what is it? If it's a school policy, you have to go to the school system, the school board. If it's a law enforcement policy, you need to work with your police chief. And if it's something to do with funding, again, that's usually through an appropriations process at either the city, the county, the state, or the federal government. So what do you want to change? Okay, next slide, please. Why would the change be either really important to you? This slide is not correct. So basically, why do we want the change to happen? What would be a good thing about it happening? And this was, I guess, based on why would changing marijuana laws be detrimental? But again, whatever you want to change, you have to explain why the change is needed. And to do that, you need to go back to your data. You need to document the extent of the problem that you're trying to get on top of, the facts, the figures, and the anecdotes. So document why you need the change, not why the change would be detrimental. Very sorry about that. We'll change that slide going forward. Next slide, please. So the next thing is, who has the power to make the change that you want to see happen, or stop the change that you don't want to see happen, or mitigate the impacts of a change that's already happened, but that you still might have power to do something about through a regulatory process. So let's go to the next slide. So you need to figure out, based on the change you'd like made, what system has the power to make the change? Is it the legislature? Is it the executive branch, which is why we have a picture of the White House, but that could be the governor, that could be your mayor. Is it a planning or zoning commission change? Or is it a regulatory change and that you need to go to a state agency about? So what system? Next slide, please. And what people in the system have the power to help you? So if it's the executive branch, we have Biden for federal, executive branch. So that would be if you want to get a regulation changed, work with a federal agency to have them change the way they do business somehow. If it's a legislative change, you have to go to the people in the legislature, hopefully the people on the key committees and in leadership who can help you. If it's a zoning thing, you've got to go to the zoning board. And if it's something to do with city policy, you have to go to your mayor. So you need to figure out what system you need the change made in, and then what people in the system you need to get to make your case to them that they should help us get the change made. Next slide, please. So know and fully understand whatever process it is that you're working with. This is obviously the federal legislative process. I know a lot of you are in different states, and states have different state legislative processes. Some states have state legislatures that are in session all the time, others don't. And you have to understand the timing of the legislative process. If you want to get something through city council, you have to understand the process for doing that. When they are holding hearings, when they're interested in getting new ideas presented to them. When does the zoning board meet? How much in advance do you have to get them what it is that you want to get on the agenda? You really have to know and fully understand whatever process it is that you're trying to work in to get the changes made that you want made. Next slide, please. So keep the following in mind. I've been really successful in what I've done because I always do all the work for the legislators at the federal level, meaning if I want them to, introduce a bill, I actually write the bill language for them. I give them the talking points. I give them the data points. If I want them to include report language in a piece of legislation, I write a draft of that report language and give it to them. The more work you can do when you go in, the more likely you are to get what you want. These people are really, really busy. So you can make a great case for something, but if you haven't done the work in advance to actually give them copies of what you'd like to see happen, it's likely that it's more work than they're going to be willing to do, unless this was something that they really wanted to do anyway and they were working on anyway. Ensure your written output is clear, concise, and understandable. Not only legislators, everyone ignores what they can't understand. Never use acronyms. Nobody, it's like an alphabet soup. No one knows what the SPF is, or CSAP, or SAMHSA. They don't have a clue. So make sure that you spell everything out if you're using an acronym, and that also that you have bullet points that are as clear and concise as possible. Getting to the right sponsors and co-sponsors of bills is really important, because if someone's on the right committee, they're much more likely to be able to help a piece of legislation move through the process than if someone just sort of introduces a bill and then they themselves in the legislature have to go to someone else to get the bill considered. Be as bipartisan as you possibly can. Get both Republicans and Democrats to support you. You're much more likely to get the outcome you want if you have support from the beginning from both parties. Try to get as many co-sponsors as possible. That really helps you. The more legislators that say, yeah, we can sign on to this before it's voted on, the more that their colleagues know that this is something that has a lot of support. And then work with your allies to increase support and gain additional co-sponsors on anything that's legislative. If you have legislative champions, those are the people you can use to help you gain support. But I'm going to tell you about doing the work for them. We're working on a couple of bills now where we have a sponsor and they asked us to try to get the co-sponsors. And so we're coming out to you guys to ask you to ask your members. And we just did this in Alaska. Senator Murkowski might come on as a co-sponsor of Bruce's law, but we were the ones that needed to get the people in Alaska to tell her that that's something that was important to Alaskans. Another thing is anything that you want to do, whether it's a bill or a zoning change or an ordinance, you need to get to the people who have the power to make the change as early as possible, when there's still enough time to get something through the process, either the legislative process, the regulatory process. And you have to understand the timing of everything, because especially for regulations, you get a specific amount of time to comment. And if you don't comment in that time period, your comments aren't going to matter and won't be taken into consideration. So especially for legislative stuff, many things die at the end of sessions because they're introduced too late to actually be marked up and go through the whole legislative process. So getting in the door early at the very beginning of a legislative session is ideal. And hey, we have a chance to do that because of yesterday's election. We have a new Congress in Washington anyway. And I know in most of your state capitals and in a lot of your city councils and county commissions, there are going to be new people that we can get to and be starting the process all over again. So in the federal level, any bill that doesn't get passed in a specific session of Congress, at the end of that Congress basically is dead, and it has to be reintroduced again in the next Congress. And again, getting it done early as possible is really critical. Next slide, please. So is timing a factor? It's a critical factor in everything, in getting to people early with an agenda item, to getting to people with funding requests early so that there's still money left for them to consider giving you. So the earlier you make your case in any process, even in making a school policy change, the better, because otherwise they get bogged down in a lot of other things that are important to a lot of other people. And we want to make sure that we're vocal, visible, and show our value early in the process so that we have a chance to get our stuff, not just have a hearing, but completed, and that we can get a win. Next slide, please. So you need to find out what the major issues the decision makers you want to influence care about. They don't always care about substance use issues. So next slide. What do we need to do? We need to determine the top priorities of the people in the systems that we're trying to convince to change something or not change something, whether it would be education, public safety, health, the economy. We can connect the dots for them between all of these issues and substance use prevention, treatment, recovery, support, and harm reduction. We can. We just need to know what their priorities are so we know how to pitch what we're going in with. Next slide, please. So here you go. You need to connect the dots for them so that they can understand our issues will be really helpful to them in getting what they want in educational outcomes, in reducing healthcare costs, in reducing crime. Everything that we do can contribute to other issues that they really care about. So not only go in making your case, but try to make the case that it's going to help other issues that are of major importance to the people you're trying to convince to help you. Next slide, please. And specifically tailor your data and your messages to their priorities if you can. We have some amazing examples of coalitions that can not only show that drug use rates have gone down exponentially in their communities, but they can show over the same period of time that high school graduation rates have gone up exponentially, that kids' grades, standardized test scores have gone up. We have some great examples of people doing this in Carter County, Kentucky, that was at the epicenter of the opioid epidemic. And they went from being a school that was on a list of the worst schools in the state that needed intervention from the state to a blue ribbon school over a basically 10-year period while they were doing their DFC. So very important. That really spoke to people, and it made them realize crime went down, overdoses went down. They had a lot of related metrics that were of interest to decision makers. Okay, next slide, please. So you have to ask yourself when you're going in and asking for something, what would it take to make them care about the issues that we care about? They need to hear from specific people that they trust in the community? Do they need to see data? Do we need to bring in people who have lost their children to overdoses? Do we need to bring in youth who feel that the social norms in their school and community are not conducive to making healthy choices? What would it take to make them care? And then the second thing is, what would it take to make them act on caring? And a lot of that is really doing a great job, and we're going to get into this in a minute, organizing enough people in the community who are from different sectors, and this is where coalitions really come in, taking the same message to them, but different messengers wearing the hats. And also, obviously, what it would take to make them care. In this case, in the opioid and stimulant epidemics and fentanyl, is all the people who are dying of overdoses. That's what it took to make people in Washington actually wake up and care at all about what was going on in the drug in the past 5 or 6 years. Next slide, please. So you have to document your case to meet the priorities of the people that you're meeting with. So again, you need facts, statistics, and anecdotes, and you need to cite your sources. I can't, really emphasize this enough. Your one-pagers, the reduced to one page, really matter. It blows people away if they can see a chart or a graph that shows them visually in one look that you either have a gigantic problem or that you've had great success doing something. So use your facts and stats, and always think about what story would best put a face on the facts and statistics and how you're documenting your case. So who you're bringing with you: youth, parents, medical professionals, police, first responders. Think carefully about who you're going to bring with you to tell the anecdotes. And they need to actually mesh, obviously, with the data, as I told you previously. Next slide, please. So most importantly, have a very, very, very clear ask. Go in knowing exactly what it is you want to change and why. Next slide, please. So, so once you know what it is you want to change, and I'm going to just throw out an example, we would like to get more funding for substance use prevention at the community level. Okay, so one, the system, if you're going to do it at the community level, would probably be your city council, county commissioner. You need to understand what the appropriations and budget process is for those people. You need to get to the people on the right committees to make your case, bring your data. Okay, so once we've sort of done that, you need to figure out, well, who else in the community would care about this? Who are your potential allies in the community? Next slide, please. And so are they parents, teachers, business people, the media, the medical community, treatment providers? Think very carefully who would be on your side in trying to help get more funding for substance use prevention. People in the child welfare system. I mean, you can really think broadly about that. So once you figure out who your allies are going to be, you figure out who's going to be in your advocacy coalition, which is very different than your actual DFC coalition, because this is people that on a case-by-case basis, you want to get involved on a specific issue. They don't have to work with you all the time on everything, but on this specific issue, you need people who are going to be willing to sign their names to a petition or a letter, show up with you to a meeting, and make their voices heard. So next slide, please. You have to figure out the shared interests of the people that you're asking to help you and that you'd like to join in with you in your advocacy work. And how are you going to convince them to join? This is interesting. This was from the Hill, and it was one of the Hill days where we were trying to get the Sober Truth on Preventing Underage Drinking Act, the STOP Act, passed. And boy, we have a lot of allies for underage drinking prevention. Schools, healthcare professionals, doctors, again, child welfare, parents, you name it. There's a lot of people interested in reducing underage drinking, and we need to figure out who in the community those people will be and why they would like to join with us to get something passed to actually fund local underage drinking efforts. Next slide, please. So questions to ask yourself are, do you have important champions in the system that you're trying to advocate to? Do you have them to help you make the change or stop the change or mitigate a change once it's passed? And I want to say again, to mitigate the impacts of a change once it's passed usually is through regulations. It's usually hard to get a law repealed, but once something passes, it's the executive branch that actually has to implement the regulations. And so getting good regulations in place can be very, very important. And so you need, people in the public health system or in another federal, state, or local agency that can help you. So we definitely need champions in these systems because they're the ones that have to actually make the change happen. We can just advocate for it, but we don't vote for laws. We're not legislatures ourselves. So we need champions in these systems. Next slide, please. So who are you going to ask to help you in recruiting champions? Obviously, people who have some stature in the community, who know a lot of people, people who who have made political contributions to these guys, who they play golf with, who they do Pilates with, who they go to church with. people who know them because their kids play Little League baseball. So you need to think through who you know that know the people that you would like to get to be your champions. And ask people to help you do that if these are not people that you know, which doesn't mean you can't go in cold and try to get new champions yourself. You certainly can do that, but it's always easier to get some help recruiting champions of sort of other key influentials that can be helpful. Next slide, please. And who you bring with you to make your case when you want to have a meeting. And this is something to think through. You obviously want someone that can really explain the data extremely succinctly, who understands the one-pagers that you're bringing with you and can make the case. You then need to think, who's the anecdote person? Who's the person who's going to put a face on the data? Who's going to tell the story? And of course, all this depends on what it is exactly you're trying to change. Who else you're going to bring with you? Maybe a key influential or the person that actually personally knows the person you're meeting with. I would definitely bring youth. There are fabulous messengers for us, but think carefully, who are the best people that you would want to bring with you to make your case to key influentials and elected officials. Next slide, please. This is really important. Anything that we're trying to do, someone is going to be an opponent. Somebody is not going to like the fact that we're trying to either make a change or stop a change. And in what we do in substance use prevention, a lot of times those people are very well-funded industries like the alcohol industry, the tobacco industry, the marijuana industry. Sometimes it's people who are selling vapes and Delta 8 to kids. And they're making money. They obviously don't want some of what we'd like to see happen. So we have to really think through who's going to be opposed to what it is that we're trying to accomplish with our advocacy efforts. Next slide, please. Then you have to really think through with your allies and the people that you're working with, what is it that your opponents are going to say or do to try to defeat you? So you really need to lay out all of the arguments you think your opponents are going to use to defeat you, all of them, and throw anything in the hat you can think of. And then you need to go through a process of countering every one of the arguments you think your opponents are going to use against what you're trying to do, and come up with talking points to say, well, they might say this, but on the other hand, our youth are really getting this, and this is a problem. And we brought kids to meet you who are addicted to vapes, anyway, any argument that they're going to come up with, you need a counter argument, so you understand what you're going to face when people are going to go, well, how about this argument? And you'll be prepared to say, well, we've thought that through and we think that isn't valid for X, and then again go back to your own talking points. Okay, next slide, please. So here's another really, I think, important tip. When you're trying to get anything done and it's somewhat controversial and there are people who are going to oppose you or try to defeat you, it's very important to go after support from those in the system that you're trying to work in who already agree with you, so that you can shore up their support, or undecided. They just haven't quite made up their minds yet, and they're open-minded enough that if you go in and really make a great case the way we've just described it, you can hopefully move them to agreeing with us. I would really caution about meeting with hard opponents in any of the systems, people who absolutely are on the other side of something. They're probably not going to listen to what you have to say. And you also don't want to give away all your talking points and all of your arguments to them, because we'd like to save those for the people that we can actually influence. So again, I'd say don't worry about meeting with hard opponents in the system, because it's very hard to get those people to actually change their minds. They very rarely, if ever, do. Next slide, please. Ensure that you testify at any hearings on the issue. Obviously, you have champions you've been working with. They know that you're an expert. Even if you are federally funded, if you get a written letter from a legislative committee asking for you to testify, you can. And if you can't, make sure someone from our side of the issue that actually can testify is actually asked to testify. And I know at the local level, at a lot of these hearings, you just have to line up outside the hearing room the day of the hearing. It's not like they invite people like they do in Washington to testify. And you need as many people lined up with the talking points that are really clear, concise, and consistent as possible to get to the microphone. And anyone can do that as themselves. So if you're worried about testifying at a hearing because you're federally funded, you can go and say, I'm Sue Thaw. A lot of you know that I work for CADCA, but I'm actually here today on my own time and my own dime as a constituent, as a public health expert, and I have the following to say. Next slide, please. Definitely use the media and social media to help you make your case to the largest extent possible to get the data and the anecdotes and what you're trying to do out to the community at large so that you can raise awareness. And also because elected officials read the newspapers. They actually care what they say. They listen to the radio. They actually are up on some of this. So, use as many different channels as you can to get the word out about what it is you're trying to accomplish and why it's really important. Next slide, please. So I think it's really important in undertaking any of this to decide, can you win? Okay, and sometimes we know we can win. Sometimes we're not so sure, but it's important is there any way we can win? Okay, next slide. Can you afford to lose? Is this something where it's such a big deal and we're going up against such well-funded people that, if we lose, there could be consequences for us? That's something to take into consideration. But the next slide, I think, is the most important one for us at public health. Can you afford not to try? And the answer is no. We really do need to try to get all of our stuff on the radar screens to try to make the policy changes that are needed to keep our communities safe, healthy, and as drug-free as possible. So I'd say, though, you need to ask yourself those questions, but usually I think even if you can't win, I think you still actually do need to try because it raises awareness, it gets you in front of the right people. And this is a long-term process. You might not win the first time out, but if you keep at it, eventually you're going to get something of what you want, if not the whole enchilada. Next slide, please. So E from the frame is evaluate your results. This is really important. So after you've undertaken anything from a whole campaign to just going through a couple of meetings with legislators or other key influentials, or in trying to recruit people in your advocacy coalition, you need to evaluate all of the results. Did you get the people you want in the community to support you? Did the meetings that you went to with elected officials and other key influentials go well? And then ask yourselves why or why not. If they didn't, what would you change if you were going to go and do another meeting? Would you bring different people? Would you bring different information, different data? So anyway, did your meetings go well? Yes or no? Why or why not? Did you get the responses you wanted or needed? Again, you need to figure out if you did, that's great, and you need to keep doing that. And if you didn't, you need to change your tactics and figure out why it didn't quite work and what you would do differently moving forward. You need to figure out what else you need to do moving forward to get what you need to have happen. Are there people that you should have talked to that you didn't? Were there people on key committees that you maybe could have gotten to that you didn't? Also, did you achieve your objectives? Did what you were trying to accomplish happen? If so, how'd you get it to happen and why do you think it happened? What worked? And if not, why didn't it work? How close did you come to achieving your goals? Is this something that you can tweak on the margin and go back again with? Or do you need to sort of scrap it or scrap part of it? What do you need to do? And in evaluating your results, I think you also have to decide if you didn't get what you want, should you try again? This is a long-term thing. And if you want to try again, when, the timing, do you want to try it in the next session immediately? Do you want to give yourself a little break to think it through more? And what would you do differently if you didn't get what you wanted? What did you learn from evaluating how your meetings went, how people responded to the case that you made, who you brought with you? So again, what would you do differently? Would you change what you're asking for on the margin to maybe ask for a little bit less, a little bit more, something a little bit different? So, and then what else do you need to do moving forward to either protect the wins that you got, to go back and try to get something done that didn't quite get done, but has a good chance of getting done? Or do you need to really sort of reevaluate and start from scratch and figure it out all over again? Next slide, please. So there's also evaluation needed to protect wins that you get. This is really fascinating. As most of you know, it is very, very, very hard to get alcohol taxes raised or tobacco taxes. It's very hard to get any taxes raised, but specifically, it's very hard to get alcohol taxes raised. And Maryland was able to get a 3% sales tax added in 2011. It was the first increase in beer and wine taxes since 1972. And in spirits, it was the first tax increase since 1955. So this was a really, really big deal that took a gigantic coalition of all the public health people, unions, parents, teachers. I could go on and on and on. But they didn't just sit on their laurels and go, oh, great, we got, alcohol taxes increased by 3%. They got 3 studies funded, conducted, and published so that they could protect their wins. And what those studies showed were that sexually transmitted diseases went way down after the alcohol tax was increased. People, especially youth who are very price sensitive, tended to consume less alcohol after the tax increase went into effect, and that alcohol impaired driving, alcohol impaired accidents, and alcohol impaired fatalities from driving went down as well. So very important to not only evaluate your process and your power analysis, but if you do win, to try to figure out how to evaluate your wins to be able to keep them. Next slide, please. So I have quickly 13 C's that I would like to share with you for maximum policy impact. I love these because they're sort of quick and dirty, and they're the equivalent of reducing to one page everything that I just told you in the last hour. And these, I think, would be fun for you to share in your communities. So what's the first C to get maximum policy impact? It's being credible. It's making sure that your facts and your data come from reputable sources, that you bring people with you to meetings who have credibility in the community, because they're experts. You're experts in what you do. You have built-in credibility because you know what's going on in your communities with youth. So being credible, very important. Next slide, please. This, oh, I think where's 2, Chris? I think we had 1. Is there a 2?
2 got cut from this presentation. I can add it in the version that goes out.
Don't worry about it, but I think if we're going to cut it, we need to renumber the slides. Okay, so be clear. Refrain from using acronyms or jargon. I had basically said that at the very beginning. Nobody out of our field, again, knows what the SPF is, or CSAP, or ATOD. There's a lot of acronyms we use that absolutely nobody else will understand what we're talking about if we use them. The other thing in being clear is go in with one message and one ask and stick to it. You don't want to bring people to your meeting that have other agenda items who are going to start talking about potholes in the street or some other unrelated issue that takes you off of your message. So you need to be very clear in how you speak and clear in what your asks are, and not use jargon or sort of jumble up what you're asking for. Next. Be concise. Elected officials and their staff are really, really, really busy. The meetings you get with them are short. You definitely need an elevator pitch. You need to have what you're going to say down so that it's second nature to you. You need to practice what you're going to say and leave enough time for them to ask you questions. These meetings never go more than 15 or 20 minutes. The most you're going to get is a half an hour. So being concise really, really matters. So, you know, the KISS principle, sometimes it's called keep it short and simple. Sometimes it's called keep it short, stupid. There's a whole bunch of different ways to say KISS, but they're all mean be concise. Next one. Be consistent. Stay on message when you advocate. This is sort of picking up on the clarity. Go in with one message and one ask. Don't go in with a whole laundry list of stuff because you have a very short time to make your case. And if you're not consistent, you're going to leave and they're really not going to understand what it is you wanted them to do for you. So stay consistent, stay on message, and make it clear what it is that you're asking for and why. Next slide, please. Be creative. Take advantage of all types of communications. This picture is from when meth was a really big problem, and we could not get some people in the federal government to understand that it was a horrible problem in Iowa, although it might not have been a horrible problem in Maryland. We went around the hill with these CADCA measuring spoons, and then we had meth, a recipe for disaster, and we actually showed people how you, this was before the super labs, obviously, in Mexico, and this is when people were still cooking meth with pseudoephedrine, but you could get all of these recipes for how to make meth on the internet. And then we, you know, showed what it looked like to have meth mouth and the real horrible health implications for people who had substance use disorders because of meth. My favorite be creative though, and I always share this when I do this slide, was I don't know how many of you have or know about keg registration, but it's when somebody buys a keg, it's actually registered to the person who bought it. So if they bring it to an underage drinking party or give it to someone else and the police show up, you can get in trouble for having provided that keg because that keg is registered to you, the person who bought it. Maryland was trying to get keg registration passed. They were having a horrible time. The state legislature was not interested. The alcohol industry was extremely powerful. And so what was the coalition of youth, prevention people, law enforcement, schools, and public health to do? Well, what they did was they came up with a campaign called Kids Plus Kegs Equal Caskets. And they had a whole bunch of caskets with kids carrying them with kegs in them up the steps of the state legislature. And they had TV cameras there because this is a fabulous visual. And lo and behold, because of all of the television coverage, and then they talked to police chiefs who were talking about, you know, deaths from underage drinking. All of a sudden, keg registration was taken up, and it did pass in Maryland. So being creative can be very, very helpful, and I'd say definitely use your youth in trying to figure out how to do something like that. Next slide, please. Be committed. As we said, none of this happens overnight. This is sort of long-term policy change takes and legislative change quite a long time. So convey your passion, follow up. But I think the thing about commitment is that success seems to be largely a matter of hanging on when others let go. Just be committed for the long haul and keep plugging. Don't give up. Really important. Next slide, please. Be connected. So this is where you're going to build your advocacy coalition. You're going to leverage relationships with all the other people in your community or your coalition so that they can connect you with legislatures or their staffs. You want to be connected to other important groups that might be important if you're doing something on vaping, the Lung Association, the Heart Association. All of those groups are wonderful groups to be connected with because, like for Tobacco 21, they were the ones that helped really get that done. So being connected to not only the people in the system that you want to see the change made in, but other key influentials and other nonprofits that can be helpful in the community is really important. Next slide, please. Again, build coalitions. And this one is more, find non-traditional allies in the community. They're not necessarily people you work with every day. They're not necessarily people in your coalition, but they're people that might have an interest. To give you an example, the faith community has an interest in a lot of the issues that we're talking about. The Maryland tax increase, interestingly, it was unions who got really involved and were very, very interested. So find non-traditional allies where you can, on a case-by-case basis, on an issue-by-issue basis. And also find people where they are. They don't always have to agree with you on every issue, but if they agree with you on this issue, then that's fine to include them in your advocacy coalition. Next slide, please. Cultivate champions, build and use relationships with legislators to make them into leaders for your cause. Invite them and their staffs to your coalition meetings. Send them the information that you have that comes up that you think they would be interested in. Make them feel that you're helping them understand these issues by sending them survey data, again, in one page, new information that you think would be very helpful to them to know so that they can say something smart on the House floor or someplace else. So cultivate champions by building relationships with key influentials all across the process, from, you know, being an expert, being a resource, having meetings with them, and also giving them awards and inviting them and their staff to present and coming to your coalition meetings. Next slide, please. Always credit others. I can't take credit for any of the policy stuff that I have accomplished because I'm not a legislator. I'm not an appropriator. I don't get bills introduced and take them through. So always give legislators and their staff the credit and awards when they help you. Bragging about what we accomplished, we couldn't do it without these people, even if it was our idea in the first place. So, and also credit others in your coalition who have been really helpful and give them awards and recognition as well. Really, really important. Next slide, please. Know when to compromise. This one is incredibly important. You can't always get what you want, but you have to know what you can settle for. And you have to know what would be too far. If you gave up too much, it might not even be worth getting the win. And I have a really interesting anecdote for this one. When I first started doing this 30 years ago, there was a tiny program in the Center for Substance Abuse Prevention called COSAP. It was Children of Substance Abusing Parents. It's when we still use the word abuse. So excuse me, this is a very old program, wouldn't be called that now, but it had never been funded. And I got a call from an appropriator who was interested in perhaps funding it. And they knew that I was like the new advocate on Capitol Hill representing CADCA for prevention. But I didn't know anything about this program. I literally had just started. So I asked my next door neighbor who worked for Senator Dodd, who it was who was the expert on COSAP, and she said, oh, it's this guy whose name I will not mention, but most of you don't know him anyway. And I thought, oh, well, maybe I'll bring this guy to the meeting with me, which was a very big mistake because he had been pushing for something all along. Well, in the meeting, this appropriator said to me, what do you think if we give you $3 million and part of it would be, this is when they did earmarks and they're starting it again, an earmark for our district. I said, I think that's a great idea because I know as someone who had worked at the Office of Management and Budget for the president, you can't build on nothing, but if someone's willing to give you some money and try out a program, by all means, that's fantastic. But the guy I brought with me to the meeting put his fist down on the table and said, absolutely not. We will not take anything less than $20 million. So you know what? They got nothing, and that program has never been funded to this day. So you have to know when to compromise, but you also have to know if you compromise too much, you can end up like it can backfire on you and you can end up having unintended consequences. So knowing how and when to compromise, I think, is critically important. And then the 13th C, which I think is the next slide, and is, I think, the last slide of these, celebrate victories. Any little thing that goes right, thank everyone in your coalition. Always thank legislators and all of your allies when you achieve any of your advocacy goals. You don't have to win the whole enchilada to thank people and celebrate. If something moves one step through the process, celebrate that, because it took a lot of work to get there. So the little things matter, and celebrate any victories that you have. Next slide, please. Okay, I'm going to pass this over to Chris Doran, but before I do, I just want to thank him. Chris is just a tireless advocate for everyone in our field. Chris worked really hard on this unbelievably amazing advocacy toolkit. He took everything that we had ever done in CADCA on advocacy and cut it down and turned it in to what I think is one of the most usable, understandable, and fantastic advocacy toolkits any group has ever done. So I don't know if you can clap on, if you're able to clap on your screens, please clap for Chris. And I'd like to turn it over to Chris to explain how to access our advocacy toolkit. So take it away, Chris.
Thanks, Sue. Thanks for the kind words. The toolkit was fun to write and a great project. And it is I think, very chock full of details document that goes through a lot of the stuff that Sue just talked about, as well as even more details and more information. It's written from the perspective of engaging in advocacy at the federal level, but it can be used for federal, state, local, town council, whatever your level of government is that you're trying to advocate to. The tips and tricks in there are excellent to use to make sure that you're getting the most out of your advocacy efforts. The link to access the toolkit is at the bottom of this slide, or it's in this QR code, which I'll leave up for a minute, that you can just scan with your phone. It'll take you to the page, download the PDF version of the toolkit. It's free. And as Sue mentioned, it's an excellent resource. So please download it. Please come to Capitol Hill Day at our forum in February to put some of these advocacy tools to work, to advocate to your members of Congress about prevention. And then at this point, I think we'll open up to questions. And then our Sue's email and my email are on the screen as well. So thank you everyone for joining us today. We'll open it up to questions.
And then Samantha, have you been following the Q&As?
Yeah, I don't have any questions in the Q&A or in the chat, but I could take people off mute if that's okay.
Yeah, if someone wants to raise their hand, can you see them?
Yeah, I'm
raise their hand.
I'm allowing them to talk, so if they would like to, whatchamacallit, they'd like to ask a question or just make a comment, that's what I'm doing right now.
Great, thank you. Yeah, I'd love to hear from people because I know a lot of you on the call. I recognize your names. I know you've done unbelievably effective advocacy yourselves. And so we have Michelle Dunn has a hand raised.
Sorry, I'm going in manually and unmuting people right now. So you just, Michelle, if you just want to unmute and you could just go ahead. I don't know if Michelle.
I don't know. It looks like Jessica Travis has her hand up.
Where's Jessica? Let me do it. Gallery.
Yeah, this is the joys of Zoom.
Let me see Jessica. Yeah, I just asked Jessica to unmute. Are you able to speak?
Hi, this is Whitney Abbott. Can you guys hear me?
Yes, perfectly. Oh, hey, Whitney, do you have a question?
Yeah, can you hear me?
Yes, we hear you perfectly. Yes. Samantha, did something go wrong with the sound because we unmuted people? No? I don't know.
There's a question in the oh, I think it's something on her
So
side.
I
There
was
is
curious the local level advocacy for.
Oh, I'm so sorry. We heard you say you wanted to do local advocacy for, and then you got cut off.
Are you aware of any local advocacy that's been done to ban kratom or?
Yeah, we actually, we can get back to you about kratom. We have, one of our trainers has done a whole bunch of sessions at Forum and Midyear about kratom. So we can talk offline about that.
Okay, great. Thank you.
Sure.
I have another question in the chat from Ms. Rivera. She's slightly new to prevention and nonprofits. She asked, what advice would you give for feeling more comfortable starting out to become more vocal?
Oh, that's such a good question. You know, decide what it is that is really important to you to share and with whom, and then you know, put your little elevator speech together and figure out, you know, who it is you want to speak to. If you want to just in general, you know, raise awareness about how important prevention is, how cost effective. Again, we at CADCA have sort of those tools. We have information on the cost effectiveness of prevention, you know, adolescent brain development, why adolescent brain development. And so it just depends what it is you want to educate elected officials on and advocate on. And then it's sort of putting together what you want to say and figuring out who you want to say it to. It's best to start with the people that actually represent you where you live. So the people you vote for at your home address are probably the right people when you're starting out to talk to, because you actually are a constituent of theirs and you vote for them. And, you know, I'd start there. But I don't know, Chris, the toolkit, I think, does give some pretty good tips and tools for how to start out.
It does. Yeah, and again, you can download the toolkit at the link that was on the slides, or you can use the QR code, which I can put back up if that's helpful to folks.
And I will go over it again, but I put in the chat where these slides will be found, and just also where you can find the webinar posted on CADCA.
Yeah, I just want to thank everybody for joining. You know, this is a really important topic. There are so many voices right now in the public square who are doing things that are really not helpful to prevention. And so the more that we can make the case that prevention is critically important, as it be, you know, really paid attention to and funded, because stopping use or delaying use is really the most cost-effective way to get on top of any substance use problems and epidemics. And those of you just starting out, we did have some slides at the very, very beginning of this that we took out because they were more making the case in general for prevention than how to advocate. But, you know, Chris, if you want to figure out a way to put those slides somewhere so that people can access them, that might be helpful.
Mm-hmm. I think, and Samantha, correct me if I'm wrong, but participants will have access to the slides after this, and the version I sent you previously had those slides included in it, I think.
Yes, we'll have the recording on the CADCA website. I have that link in my previous comment in the chat, and then the slides will also be there. And I know you also shared your email, and my email's here too if anyone had any additional questions. I didn't see any questions in the Q&A box. Is there any other questions in the chat, or if anyone wants to go unmuted just before we close? Okay.
But before we
A lot
get-
of thank yous, Sue.
Oh,
A lot of
no,
thank yous.
Before we get off, Samantha, I want to thank you, but I just want to again thank my amazing team at CADCA. Chris and Phoenix, who just started, is amazing. And so we're here as a resource. We provide a tremendous amount of technical assistance and training to people who are trying to figure out how to undertake an advocacy campaign, how to figure out what's education versus lobbying. So any of that type of stuff, feel free to reach out to us, and we're happy to set up a Zoom call to provide technical assistance on some of this stuff where you have questions or if there's any confusion. So I just wanted to make that clear. We're here as a resource. This isn't like one and done.
Well, thank you, policy team. I know this is a busy season and probably been a very busy week. So I appreciate your time, your patience, and your knowledge. And thank you everyone for attending. I put the evaluation link in the chat. You should also be getting an email. So if you would like a participation letter, and a little bit earlier in the chat, I put the link to the resources of where you'll find Wednesday webinars content and also recordings. So if you need anything, please don't feel free to reach out to myself or the policy team if you have any other questions. Otherwise, thank you for joining us.
And Samantha, before we all get off, the departmental email address is publicpolicy@cadca.org. So please feel free to email that, and Phoenix or I or Sue will respond to you. So again, thank you, Samantha. Thank you, Sue. Thank you, Phoenix. And thanks everyone for attending. This has been great.